If you're diagnosed with a myeloproliferative neoplasm, you really need to have a good relationship with your doctor and talk over all the test results, talk over all the symptoms that you might be having and what the treatment options are for you, and what the prognosis is for you as a particular patient. So a patient who has very few symptoms, who has abnormal blood counts that can be controlled with phlebotomy, for example, is very different from a patient who has a very large spleen and has, for example, multiple mutations and looks like they're progressing to myelofibrosis. So there's a real large gamut at which patients are diagnosed. Many of our treatments are aimed at preventing the worst complication of myeloproliferative diseases, which is really a blood clot, an arterial blood clot, or a venous blood clot. Patients are at higher risk of heart attack or a stroke, or even a deep vein thrombosis, which can cause a pulmonary embolism. So all of these things are things we worry about a lot when we take care of myeloproliferative neoplasm patients. So our initial therapy is really geared to trying to prevent that complication. We also look carefully at patient symptoms. So if patients have a symptom, for example, of overwhelming itching where they can't take a shower, the treatment course may be different for that patient as opposed to another patient who is complaining really basically of fatigue or night sweats. So we really a lot of our therapy is aimed toward trying to palliate one or other symptoms the patient may have with these diseases.